Hello again, welcome to another Upgrade Your OET speaking and roleplay lesson from me, Sona at Bose Learning. This lesson is all about dialysis, and Mayan, one of our YouTube students, asked me for some help about this. So I thought this was a great opportunity to practice some vocabulary and also a speaking roleplay all about dialysis. Okay, so what is dialysis and how do you pronounce it? Well, it is pronounced dialysis. And as I said in this lesson, we're going to look at explaining how it's performed using everyday lay language rather than medical language. And we're going to look at the side effects and how to explain that to your patients. For those of you who don't know me, my name is Sona. I'm a premium preparation provider of the OET with Bose Learning. Okay, so first of all then, here is a role play card for you. As you can see, the setting is a hospital ward, and in this case you're a nurse. Don't worry if you're not a nurse. If you're a doctor or one of our allied healthcare professionals, keep watching because you'll still be able to get some useful information about how to go through the role play and how to give explanations. So first of all, we look at the scenario. In this case, the doctor has asked you to explain the process of dialysis to the adult son or daughter of your female patient who's 62. The patient has presented with acute kidney injury, AKI, and needs renal replacement therapy, RRT, in the form of hemodialysis. Your task then is to greet the son or daughter. Remember, you'll always be dealing with an adult in the OET. So even if they say son or daughter, it will be the grown-up, the adult son or daughter. So greet the son or daughter and explain that the doctor has asked you to answer his or her questions about the procedure. So this is an interesting task. You're not dealing with the patient directly, but you're dealing with the patient's son or daughter. And quite often you have to do this. Quite often the family has lots of questions for you as well. And this is what this task is practicing. Explain what hemodialysis is and why it's necessary. They're giving you some ideas in brackets here. Kidneys temporarily not functioning, waste products and excess fluid need extracting mechanically, etc. When the OET gives you things in brackets, it's important to try and translate them into everyday language and not just to copy it down. So we'll look at some ways we can do that as well. Outline the procedure: catheter inserted, unfiltered blood with high urea removed, filtered, returned via another tube to the arm, and then explain that the process takes approximately 4 hours and should be repeated approximately 3 times that week. Reassure that the process produces good results and is painless. However, the patient may experience hypertension. Think of an everyday word for that, and side effects, for example, nausea. Nausea is the pronunciation here. Vomiting, remember that hard V sound, vomiting. Headaches, cramps, fatigue, and sepsis can occur occasionally, but the patient will be closely monitored. So you're reassuring the son or daughter here that the mother is in good hands. And tell the son or daughter that AKI, remember, acute kidney injury, is often reversible and the need for dialysis may only be temporary. However, explain that the doctor will be available for further details and give them reassurance that even if the patient is on dialysis, they can often have a very good quality of life and maintain their hobbies and sports. So that's your task. As you can see here, there's a lot of explaining to do. Explain, outline, reassure, and tell. So this task is really testing you on your explanation giving abilities. Remember, that's one of the criteria that the assessors are going to be looking at. If you want more help with the OET criteria, then why not take a look at our Udemy course, which goes into that in great detail, and the information for that course is listed in the information box below. Okay, As ever, just a quick mention to remind you that I'm not a healthcare professional, I'm an English teacher. I've got lots of experience teaching English, but I have no experience in medicine, but I'm not medically trained. So all my information comes from reputable sources. In this case, the NHS, we've got Best Practice, kidney.org, and also thinkkidneys.nhs. Again, I'll put all these websites in the information box below so you can take a look at them too. Okay, let's have a look at the first task then, which was the explanation one. Explain what hemodialysis is and why it is necessary. So we have to translate this into language that's easy for your patient, in this case the patient's son or daughter, to understand. How can you do this? Well, you could say something like this. Can you fill in the gaps? Have a look through. How would you complete these sentences? Okay, any ideas? Well, we could say normally the kidneys filter the blood, removing harmful waste products and excess fluid, and turning these into urine to be passed out of the body. So this is what normally happens in our everyday lives when our kidneys are functioning properly. They filter the blood, they remove harmful waste and any extra fluid, and this becomes urine, which we pass out of the body. When the kidneys are not working properly, then perhaps we need dialysis. And this is a procedure to remove waste products and excess fluid from the blood when the kidneys stop working properly. It often involves diverting blood into a machine or to a machine to be cleaned, and that's what the machine is doing. That's what dialysis is, isn't it? It's the cleaning process. And that's an explanation that you can give to your patients or their carers. Okay, how can you explain the procedure? Here are some ideas. Again, can you fill in the gaps? Okay, so we can say hemodialysis is the most common type of dialysis. There are other forms. In the role play, they're not asking you to go into that, they're only looking at hemodialysis. During the procedure, a tube is attached to a needle in the arm. You don't need to call it a catheter, you can do and explain what that is by saying a tube is attached to a needle in the arm. Blood passes along the tube and into an external machine that filters it before it's passed back into the arm along another tube. So the preposition here is along. Okay, what about the side effects then? Again, can you fill in the gaps? Okay, so the process itself is painless. So remember, the son or daughter was worried about the comfort of their mother. So the process itself is painless, but low blood pressure or hypertension is one of the most common side effects of hemodialysis. So again, it's perfectly fine to use the medical word, but always explain that in lay language. It can be caused by the drop in fluid levels during dialysis, and low blood pressure can cause nausea and dizziness. People receiving hemodialysis are at increased risk of developing sepsis. That's blood poisoning, but don't worry, we will be keeping a close eye on your mother. We'll be looking after her carefully, so please don't worry. So these are some examples of what you could say. Don't forget, you will need to put in a little bit of signalling before that. We've looked at signalling in some of our previous videos, so take a look at that. These are just the main phrases to give your explanations. But we could say something like, however, it's worth knowing, or it's important to know. So you can signal something here, for example. But as I say, have a look at our other videos to get more of an idea about how to do that. And then give some more reassurance. We can say in some cases kidney failure may be a temporary problem and dialysis can be stopped when your kidneys recover. Can you fill in the rest of the gaps? Okay, so we could say, the doctor will be along soon and will be able to answer more of your questions about this. This is a nice way of saying the doctor is busy at the moment, but they'll be coming, don't worry. They'll be along soon. Many people on dialysis have a good quality of life, and if you're otherwise well, if your mother's otherwise well, she should be able to continue working or studying or doing her hobbies. She can drive, she can do exercise, swimming was important to her, I remember, and she can go on holiday. That's no problem. If you want to practice with a friend or a colleague, here is the carer card. So take a screenshot of that and practice and see how you get along. If you like these videos, don't forget to click that like button. That will help me enormously. Share it with a friend or a colleague and subscribe to us. And yes, tell everyone about these because I think it will be really nice if more people can find out about these videos. And if you want more information about our on-demand courses, take a look at the box below and I'll put in some discount codes for you. Thanks very much for watching. See you again next time. And don't forget, if you have any questions, just drop us a comment and we'll try and answer them. Thanks a lot. Take care. Bye-bye.